Hi, Dr. Daniel Lopez here. Today I want to share with you a tip that may help release any knots you have in your trapezius muscle or in your neck. The trapezius is this muscle that fans out from the neck out to the shoulder. And oftentimes people state they carry their stress there and they have knots, and oftentimes we get massages and injections and things, and those may not always work. And part of the reason for that may have to do with a problem in the AC joint, which stands for the Acromioclavicular Joint. Now, the trapezius attaches onto the clavicle, that's the collarbone here, and then also onto the shoulder blade from the back. And where the shoulder blade and the collarbone meet and have a joint is called the acromioclavicular joint, and that's out here. So what we're going to do is I'm going to show you two things that may help release the knot. So first of all, the very first thing you have to do is evaluate your trapezius knot. So you want to get a hold of this fleshy part and give it a squeeze and just feel along there for any knots, tenderness, and you want to feel both sides. You may note that one side may be more sensitive than the other, more sore. So the side that is the more sore, the very first thing that we're going to do is we're going to get under the collarbone, and then the collarbone, we're going to push it up towards the ceiling or up towards our head and then out. And then you'll partially be pushing it back as well. And that'll help to get the collarbone to reseat in a more correct position. Now, at the same time, next we want to find the acromioclavicular joint and try to free that up there. So what you want to do is find your collarbone, and you're going to, with your finger, maybe trace it out towards the outward, and then you may feel a little bump or a little drop off, and that's where the acromioclavicular joint is. So from there, you want to get a hold of the collarbone. So you can use a pinch or grasp, and you want to glide it back and forth, front to back. And you want to try to get it to start moving and just start working again. So you can actually also start moving your shoulder as you're gliding back and forth. That may help to free it up a little bit. And you can do that for anywhere from 30 seconds to a minute, and then go back and check to see if those trapezius knots have improved after you've done these two maneuvers. So anyway, I hope that's helped you. This certainly is not a cure-all for these trapezius knots. The trapezius muscle has a lot of places that it attaches to, but I find these two places to be common in producing these knots, and hopefully this can help you resolve it on your own. So if you want to learn more and are interested, visit my website at www.daniellopezdo.com. Thank you.